Hello learners, today we are discussing new topic health and medicine module 4 1.1.2. At the end of this session you will be able to understand the following: meaning and basis of health, illness and disease, globalization of health, illness and medicine, meaning and social basis of health, illness and disease. Health is a state of complete well-being, physical, mental, and emotional. This definition emphasizes the importance of being more than disease-free and recognize that a healthy body depends upon a healthy environment and a stable mind. Medicine is the social institution that diagnoses, treat, and prevent diseases. To accomplish these tasks, medicine depends upon most other sciences, including life and earth sciences, physics, chemistry, biology, and engineering. Sociology assumes that a functioning society depends upon healthy people and upon controlling illness. In examining social construct of health and illness, American sociologist Talcott Parson identify what he called the sick role or the social definition of behavior of and the behavior towards those whom society define as ill. Parsons identified four components to the sick role. The sick person is not held responsible for being sick, not responsible for normal duties, not supposed to like the role, supposed to seek help to get out of the role. Although many believe that science alone determines illness, this sociological view points out that society determines sickness as well. For example, the cultural define diseases as legitimate if they have a clear scientific or laboratory diagnosis, such as cancer or heart attack. Sociological perspective of medicine also talk about different perspectives such as functional perspective, conflict perspective, symbolic perspective, and their major assumption on society. First, we discuss functional perspective and its major assumptions. Functional perspective major assumptions are good health, effective medical care are essential for smooth functioning of society. Patient must perform the sick role in order to be perceived as legitimately ill and to exempt from their normal obligations. The physician-patient relationship is hierarchical. The physician provides instruction and the patient needs to follow them. Conflict perspective major assumptions. Social inequality characterize the quality of health and the quality of health care. People from the disadvantaged social background are morally likely to ill and to receive inadequate health care facilities. Partially to increase their income, physicians have tried to control the practice of medicine and to define social problem as medical problem. Symbolic interactionism major perspective. Health and illness are social construction. Physical and mental condition have little or no conditions. No objective reality, but instead are considered healthy or ill condition only they are if they are defined as such by a society. Physicians manage the situation to display their authority and medical knowledge. Functionalist approach. As conceived by Talcott Parsons in 1951, the functionalist perspective on health and medicine emphasizes that good health and effective medical care are essential for a society's ability to function properly. For a person to be considered legitimately sick, said Parsons, several expectations must be met. He referred to these expectations as the sick role. First, sick people should not be perceived as having caused their own health problem. Second, sick people must want to get well. Third, sick people are expected to have their illness confirmed by a physician or other healthcare professionals and to follow the professional advice and instruction in order to become well. Physicians also have a role to perform, said Parson. First and foremost, they have to diagnose the person illness, decide how to treat it and help the person become well. The conflict approach emphasizes inequality in the quality of health sector and of healthcare delivery. Concord in 2009. Society inequality, along with social class, race, and ethnicity and gender lines, are reproduced in our health sector and healthcare. People from disadvantaged social backgrounds are more likely to become ill, and once they do become ill, inadequate healthcare make it more difficult for them to become well. The conflict approach also critiqued the degree to which physicians over the decade have tried to control the practice of medicine and to define various social problems as medical ones. Critique of the conflict approach says that its assessment of health and medicine is overly harshly and its criticism of physician motivation far too cynical. Third approach, the interactionist approach. The interactionist approach emphasizes that health and illness are social construction. This means that various physical and mental conditions have little or no objection reality, but instead are considered healthy or ill condition only if they are defined as such by a society and its member. Buxer in 2009, Lorber and Moore in 2002. The symbolic interactionist approach has also provided important studies of the interaction between patients and healthcare professionals. Consciously or not, physicians manage the situation to display their authority and medical knowledge. Critique faults the symbolic interact approach for implying that no illness has objective reality. Many serious health conditions do exist and put people at risk for their health regardless of what they or their society thinks. Critique also say the approach neglects the effect of social inequality for health and illness. Next subtopic, globalization of health, illness, and medicine. Globalization of health, illness, and medicine. The nation of the world differ dramatically in the quality of their health and healthcare. The poorest nations suffer terribly. Industrial nations throughout the world, with the notable exception of the United States of America, provides their citizens with some form of national health care and national health insurance. Read 2009. Although their healthcare system differ in several respects, their government pay all or most of the cost for healthcare, drugs and pharmaceuticals, and other health needs. A globalization of coronary heart diseases, stroke, diabetic, obesity is occurring throughout the world. Recent day pandemic of coronavirus also include in this line while heart disease is declining in developed countries. It is rising dramatically in developing countries that are now influenced by diet and lifestyle of developed nations. The sociology of health and illness require a global approach of analysis because the influence of societal factors varies throughout the world. Diseases are examined and compared based on traditional medicine, economics, religion, and culture that is specific to each region. In this session, we have discussed meaning and social basis of health, illness, and disease, Globalization of health, illness, and disease. Sociological perspective on health and medicine. MCQ question related to this topic. Question statement. This theory argue social inequality, characterize the quality of health and quality of health care. A. Symbolic interactionism. B. Conflict theory. C. Limited effect theory. D is functionalism. Correct answer is B. Conflict theory. Happy learning. Have a good day ahead.